Hello dear students, welcome to my channel. So today I am going to discuss very important topic, that is ventricular septal defect. Already I have started discussion of congenital heart disease. So in that already I have discussed about the atrial septal defect. So today I am going to continue with the ventricular septal defect. Okay, so let's begin with the ventricular septal defect. First one is definition. Ventricular septal defect is a congenital heart disease where you can see here ventricular septal defect is a abnormal communication, okay, abnormal communication between the ventricle and left ventricle. Okay, there is a hole formation in the ventricular septum where there is a abnormal communication, and this will result in shunting of blood, that is moving of blood from left ventricle to the right ventricle. So what is ventricular septal defect? Ventricular septal defect is a abnormal communication between the right ventricle and left ventricle, resulting in shunting of blood from left ventricle to the right ventricle. Okay. Now, what is the etiological factors? What are the causes of this ventricular septal defect? So, the causes of ventricular septal defect, first is like the exact cause of ventricular septal defect is not known. Okay, so that is why it is known as idiopathic. Okay, the exact cause of ventricular septal defect is not clear. Next one is genetic and chromosomal abnormality. Okay, so ventricular septal defect is mostly associated with the genetic or chromosomal abnormality such as Down syndromes, Klinefelter syndromes, Turner syndromes. So in this chromosomal abnormality, okay, when we examine the heart, there will be congenital heart disease. So genetic and chromosomal abnormality are associated with the congenital heart disorders. Next one is teratogenic infection. Okay, teratogenic infection, that is a infection that occurs to the pregnant mother during the first trimester. So that can also give rise to ventricular septal defect. Okay. Next one is teratogenic drugs. That is some drugs. Okay. So when a mother takes some drugs during the pregnancy, especially thalidomide, so that can also result in giving rise to congenital heart disorders. That is a ventricular septal defect. Next one is alcohol consumption during pregnancy. When mother takes excessive alcohol during the pregnancy, so that can result in giving rise to ventricular septal defect. Next one is maternal insulin dependent diabetes mellitus. Okay, if mother suffer from insulin dependent diabetes mellitus, that is a type 1 diabetes mellitus, so that can be the cause for ventricular septal defect. Next one is fetal hypoxia. Okay, fetal hypoxia is nothing but a decreased oxygen supply to the fetus during the pregnancy. So that can also result in giving rise to ventricular septal defect. And next one is birth asphyxia. Birth asphyxia is nothing but when the baby is unable to establish breathing after the birth or during the second stage of the labor, when the birth of the baby happens, when it is unable to establish breathing, so that is known as birth asphyxia. So that can also be cause for the ventricular septal defect. Okay, so these are the causes of ventricular septal defect. Now let us see what are the pathophysiology of ventricular septal defect. So pathophysiology of ventricular septal defect. So what happens here? Okay, so an hole is formed. Okay, that is an opening is formed in the ventricular septum. So this will lead to lot of pathological changes. So let's discuss the pathophysiological. Okay, so this is a right atrium, left atrium, right ventricle, left ventricle. Okay, so what happens here? Due to etiological factors, what happens here? There will be ventricular septal defect. Okay, ventricular septal defect. And because of this, what happens here? There is a shunting of blood. There is a movement of blood from high pressure in the left ventricle to the low pressure in the right ventricle. The pressure and volume of the blood in left ventricle is more than compared to the right ventricle. So there is a shunting of blood, moving of blood from high pressure in the left ventricle to the low pressure in the right ventricle. Okay, there is a shunting of blood. Okay, shunting of blood. Okay, that is high pressure in left ventricle into low pressure in right ventricle. So because of this, what happens here? The volume and pressure. Okay, the blood volume and pressure. Okay, so the volume and pressure in right ventricle increases. So this will lead to what happens here? Right ventricular hypertrophy. Okay, right ventricular hypertrophy and hyperplasia. So then what happens here? Right atrium. Okay, this right atrium is unable to. It is unable to empty the blood completely into right ventricle. So this right atrium is unable to empty the blood completely into the right ventricle. So next what happens here? Pressure. Okay, the pressure and volume of blood in right ventricle, it increases. So because of this, what happens? Right atrial hypertrophy and hyperplasia takes place. So finally what happens here? There is a backflow of blood. Okay, there is a backflow of blood from right atrium to the superior vena cava and inferior vena cava. Okay, so finally there is a backflow of blood from right atrium to superior vena cava and inferior vena cava. Okay, and this will finally result into peripheral edema. Okay, so due to backflow of blood from right atrium to the superior vena cava and inferior vena cava leads to peripheral edema. It leads to peripheral edema. So once again I will tell you this pathophysiology. So first what happens? Due to etiological factors, there is a defect in the ventricular septum. This results in shunting of blood from high pressure in left ventricle to the low pressure in right ventricle. So because of this, what happens here? The volume and pressure in the right ventricle increases. So this leads to right ventricular hypertrophy and hyperplasia. And next what happens here? Right atrium is unable to empty the blood completely into the right ventricle, and the pressure and volume in the right atrium also increases. So this will show right atrial enlargement. Okay, there is a right atrial hypertrophy and hyperplasia, and because of increased volume of blood in the right atrium, there is a backflow of blood from right atrium to the superior vena cava and inferior vena cava, and this will give rise to peripheral edema. Okay, so this is a one-sided pathophysiology. Next, another pathophysiology. That is due to etiological factor, there is a structural defect, that is ventricular septal defect. So because of this ventricular septal defect, that is a opening at the ventricular septum, what happens here? There is shunting of blood. Okay, there is a shunting of blood from high pressure. Okay, from high pressure in left ventricle to low pressure in what happens? Right ventricle. So because of this, what happens here? There is a increase pulmonary blood flow. Okay, so what happens here? There is a sending of blood from left ventricle to the right ventricle because the pressure in left ventricle is more than the right ventricle. So because of this, what happens here? More amount of blood sent from left ventricle to the right ventricle, and more amount of blood will go for the oxygenation, that is through the pulmonary artery. So there is increased pulmonary blood flow. So this will lead to what happens? It will lead to pulmonary hypertension. Okay, so normal pulmonary artery pressure is less than 20 mmHg during the systole, during the contraction. So here what happens? Pulmonary blood pressure will increases because more increased amount of blood will go to the pulmonary artery. Okay, and then what happens here? So there is a pulmonary hypertension, and after that what happens here? There is increase pulmonary artery capillary pressure. Okay, so pulmonary artery capillary pressure also increases. So because of this increased pulmonary artery capillary pressure, what happens here? The fluid will start forcing a fluid from pulmonary artery capillary into the alveoli and alveolar structures. Okay, so what happens here? This is the alveoli. Okay, these are the pulmonary artery capillary. So what happens here? More and more amount of blood is coming to the pulmonary artery. So pulmonary artery capillary pressure increases. So this will what happens here? Shunting of fluid. Okay, that is a fluid will start leaking into the alveoli and alveolar structures. Okay, so this will what happens here? There is a forcing of fluid. Forcing of fluid from pulmonary artery capillary to alveoli and alveolar structure. So this will lead to what happens here? It will give rise to pulmonary edema. Okay. So pulmonary edema will lead to recurrent respiratory tract infection. Okay. So what happens in this pathophysiology? Due to etiological factor, there is a structural defect. Okay, that is a hole in the ventricular septum that will lead to shunting of blood from high pressure in the left ventricle to the low pressure in the right ventricle. So because of this increased flow of blood from left ventricle to the right ventricle, there is increased blood flow to the pulmonary artery. So there will be more pressure on the pulmonary artery. So that will lead to pulmonary hypertension. Okay, there is more pressure on the pulmonary artery. So that will lead to pulmonary hypertension. Apart from this, there is more pressure on the pulmonary artery capillary also. There is more pressure because of increased blood flow to the pulmonary artery. Okay, there is an increase more pressure on the pulmonary artery capillary also. So this will lead to forcing of fluid. The fluid will start forcing into the. There is a movement of fluid from pulmonary artery capillary into alveoli and alveolar structures. So that will give rise to pulmonary edema. So whenever there is pulmonary edema, that is related, that is associated with a recurrent respiratory tract infection. So the child will have a recurrent respiratory tract infection. So this is another side of the pathophysiology. Now one more pathophysiology of this ventricular septal defect. So due to etiological factors, there is a structural defect, that is a ventricular septal defect. So because of this ventricular septal defect, what happens here? There is a shunting of blood from high pressure. Okay, shunting of blood from high pressure in left ventricle to low pressure in right ventricle. Okay, there is a shunting of blood from high pressure in the left ventricle to the low pressure in right ventricle. So because of this, what happens here? Whenever the left ventricle contracts, some amount of blood will go to the right ventricle and only some amount of blood will go to the aorta. Okay, so some amount of blood will come to the right ventricle, some amount of blood will go to the aorta. So because of this shunting of blood from left ventricle to the right ventricle, what happens here? There will be decreased stroke volume, decreased cardiac output, and decreased peripheral tissue perfusion. So overall, it will lead to failure to thrive. Okay, that will lead to what happens here? Failure to thrive. Failure to thrive means the child will not achieve optimum height and weight during its developmental milestone. During the development of the child, it will not achieve optimum height and weight. So that is known as failure to thrive. So what is the next pathophysiology here? Due to etiological factors, there is a ventricular septal defect. So that will lead to what happens? Shunting of blood from high pressure in the left ventricle to the low pressure in the right ventricle. So what happens here? So when blood shunt from left ventricle to the right ventricle, what happens here? There is a decreased stroke volume. Okay, because of shunting of blood, so less amount of blood is ejected from left ventricle into the peripheral tissue perfusion. So decreased stroke volume, decreased cardiac output, and decreased peripheral tissue perfusion. They have all the body parts will get a less amount of blood supply. So because of this, there is a failure to thrive. The baby will not achieve optimum height and weight. So this is a pathophysiology of a ventricular septal defect. Okay. And one more important thing is that And one more important thing is that this ventricular septal defect is one of the most common congenital heart disease. When compared to other congenital heart disease, this is the most common congenital heart disease. Okay. Next discussion we will discuss in next video. Thank you.